Now about lungs. You probably know that lungs are gas exchange organs, right? So probably you know also that we have right lung and left lung. So we have two of them, right and left. What was happening when we were discussing trachea? We said that then it gives us principal bronchi, which are entering lungs, and those are dividing into 9 times approximately, and then they are giving us terminal bronchi, which are connecting to the alveoles. All these things happen in the lung already. So principal bronchi enter lungs, okay? After that, all of these divisions of the bronchi and so on happens in the lungs. Now, we have to know that, first of all, lungs have 2 parts, both of them, right and left. So you have 2 parts. Base and apex, okay? Base and apex. Also, they have surfaces, and we have to know what surfaces they have. They have costal surface, they have diaphragmatic surface, they have intralobular surface, and I will tell you what is lobes, I will tell you right now. And finally, they have medial surface. Medial surface is the surface which is facing, where these lungs are facing each other. But to be more specific, actually, medial surface itself is divided into 2 parts. Vertebral surface, pars vertebralis, which is facing vertebral column, and mediastinal surface. Mediastinal surface is exactly what is facing each other, okay, these lungs, between in the medial portion of the surface which is facing each other, right and left lung. Now, right and left lung are somewhat different, and we have to know these differences. First of all, right lung is more well, this right lung, first of all, you see how here we have this notch, okay? Why do we have this notch? How do you think on the left lung? Because of the heart, and so that this is called cardiac notch, okay? Cardiac notch. And after cardiac notch, here we have lingula pulmonis, and this lingula pulmonis we get because of this cardiac notch, because we have this notch, then we get this lingula. Lingula, what is lingula? Lingua is it's a tongue, right? So it's like a small tongue or whatever. So it's just a name what we have to remember. Also, this lung, as you see, it's more narrow, and this is the right one is wider. Okay. One more difference that we have to know is that here on the right lung, we have two fissures. What are those? This is oblique fissure, and this is also oblique fissure, and this is horizontal fissure. Now, if we have here 2 fissures and we have only 1 fissure here, then it makes that this left lung is divided into 2 parts, into 2 lobes, okay? Superior lobe and inferior lobe. In this case, we have 2 fissures, oblique fissure and horizontal fissure. So it gives us 3 parts of the lungs, superior, middle, and inferior parts. So that is also difference between right and left lung. Now, as we said, lungs have base and they have apex, but they also have a root. And what is root now? Root is a place where things are entering to the lung. We had porta hepatis, right? And if you remember, can you tell me, anybody, what was the elements of porta hepatis?
Porta vein,
proper artery, and common bile duct. Exactly. So in this case, we also have the same thing, but we call it hilum pulmonis. Okay, hilum pulmonis. This is called hilum pulmonis, which is also called a root. And here we have to know the elements of this hilum pulmonis. Now, first of all, here we have what are entering lungs? Principal bronchi, we said that. Also, pulmonary veins and pulmonary arteries. Now, the location in right and left lung of these elements are different. So we have to know. how are they located? In the right lung, first we have principal bronchi, then we have pulmonary arteries, and don't be surprised that they are blue, because we know that pulmonary arteries are carrying the blood, which is full of CO2. And then we have pulmonary veins, which are leaving lungs and going to the heart and carrying the blood full of oxygen, right? So in the right lung, we have principal bronchi first, then we have pulmonary artery, then we have pulmonary vein. In the other hand, if you're writing, I can speak slower. Okay. In the left lung here, we have, first of all, we have pulmonary artery, then we have principal bronchi, and then we have pulmonary vein. So that is different between right and left also. Okay? Now, so we said that we have alveoles which are contacting with these arterioles and so on, and they are exchanging this gas, right, with the blood vessels. The structural and functional units of the lungs are called acinuses. Okay, structural and functional units of the lungs are called acinuses. Acinuses, whatever you see here, it's acinus. They have a grape shape. Okay, you know grape, right? A fruit. So they are shaped like a grape. Each acinus consists of nearly 500 alveoles. Okay, so each acinus consists of 500 alveoles, which are connecting with the blood vessels, and actually this gas exchange happens on the alveoles, not in the alveoles. So when I ask you where it happens, you have to say on the alveoles, on the surface of the alveoles. Then these acinuses, we have nearly 15 to 18 acinuses are creating lobule, okay, lobule. So 15 to 18 acinuses together are giving us a lobule. Then these lobules are also uniting. Nearly 2,000 to 3,000 lobules are uniting and giving us segments. Okay, I'll show the segments. These are segments. In each lung, we have 10 segments. Okay, and after that, we know the biggest divisions are lobes. Lobes, we have superior and inferior, and we have superior, medial, and inferior in the right one. And one more thing I want to tell you about acinuses is that acinuses have sacs, you know that sacs, right? Yeah. And they also have ducts, ductus, okay? So acinuses have alveoles, they have ducts, they have sacs. Now, about segments. We said that in each lung we have 10 segments. But we have to know what segments we have in each lung. So we said that, first let's discuss the right one. We said that we have superior, medial, and inferior portions of the lungs. In the superior lobe, we have 3 segments. We have apical segment, we have posterior and anterior segments. So we have apical, posterior, and anterior segments. In the middle portion, we have lateral and medial segments. Lateral segments and medial segments. And in the final inferior lobe of the right lung, we have 5 segments. Out of these 5 segments, 1 is apical segment again, and 4 are basal segments. Anterior basal segment, posterior basal segment, medial basal segment, and lateral basal segment. Okay, I will give you this picture, and if you want to, you can look closer. So in the inferior lobe, we have 1 apical segment and 4 basal segments: anterior, posterior, medial, and lateral segments. Now, about left lung, we said that here we also have 10 segments, but we have only 2 lobes, superior and inferior. So in each lobe, we have 5 segments. In superior segment, we have again apical segment, posterior and anterior segments, and that's the same. And additionally, we have superior and inferior lingular segments, okay? Superior lingular segment and inferior lingular segment. In the inferior lobe, it's the same way. We have 1 apical and 4 basal segments. Anterior, posterior, lateral and medial segments. So we have to know these segments also, okay? Now, we also have to know the borders of the lungs. About the borders of the lungs, for the borders of the lungs, we have to know the lines. Do you know the lines? What are in our body? No problem. So we have, first of all, we have, here, let's look here. We have sternal line, which is in the middle and it's anteriorly located. Sternal line, okay? Then we have medioclavicular line, medioclavicular line. Then we have axial line, okay, which are located laterally. This is axial line. Then posteriorly we have scapular line and we have vertebral line. So what lines we have? Repeat.
Axial, scapular, vertebral line.
So we have sternal, medioclavicular, axial,
vertebral,
scapular, and vertebral lines. So we are discussing these borders of the lungs towards these lines, okay? First of all, the apex of the lungs are located 2 to 4 centimeters above clavicle. 2 to 4 centimeters above clavicle, okay? Now, after that, lungs are descending to the sternal line. These lungs are descending point for right lung, and left lung is different. Why is it different? Because again, because due to cardiac notch. Because we know that on the left one we have cardiac notch. So right lung is descending until 6th rib, and left one is descending until the 4th one. Okay? So right descends until the 6th rib, left descends until the 4th one. Then this was for the sternal line. Then for the medioclavicular line. For the medioclavicular line, for the right one, we have again 6th rib. Okay? Again 6th rib. For the left one, this border then follows this cartilage and descends down to the 6th rib. So for the medioclavicular line, it's the same for both of them. Both of them are located on the projection of the 6th rib. Then for the axial line, we have both of them again on the projection of the 8th rib, okay? 8th rib. Then on scapular line, we have again both of them on the projection of 10th rib. And finally, for the vertebral line, we have both of them projected on the projection of the 11th rib. Okay? So the difference between right and left is occurred only on the sternal line due to cardiac notch. Other than that, all of the other borders are the same. Now, about pleura. Pleura, you know that the serous layer which is covering lungs, right? What serous layer we learned? You tell me, please. What serous layer we learned? No voice.
Mucosa, submucosa, muscular, adventitious. Serous layer.
What serous layer we learned? What serous layer? Peritoneum.
Internal peritoneum. Intraperitoneum.
So pleura is also a serous layer, right? As we had in peritoneum, we had visceral peritoneum and parietal peritoneum. Which was the visceral peritoneum? Which one was the visceral peritoneum? Which was covering the organs? Which was parietal peritoneum? Whichever was following the wall of abdominal cavity. The exact same way we have in the case of pleura. We have visceral pleura, we have parietal pleura. Visceral pleura is covering the lungs, parietal pleura is following the thoracic wall, okay? Now, between visceral pleura and parietal pleura, we have a cavity, just like we had in the peritoneal cavity. In this case, we have pleural cavity. And exactly the same way as we had in peritoneum, this cavity is lubricated, okay? It's lubricated, and we have a small amount of a liquid which lubricates it. We don't have a lot amount, we don't have like if there's a liquid inside, but it's just for lubrication and it makes breathing easier. Now, pleura, for parietal pleura, we have 3 parts, okay? Diaphragmatic part, which is following the diaphragm. Then we have costal part, which is following the ribs. And then we have mediastinal part, okay, between lungs, right and left. So we have diaphragmatic, costal, and mediastinal parts. Between these parts, pleura gives us recesses. Do you remember recess? We had in nasopharynx elevation, and then we had a recess. Yes. Okay, so it gives us 3 recesses in this case also. We have costal diaphragmatic recess. We have costal mediastinal recess, and we have phrenico-mediastinal recess. So we have 3 recesses: costal diaphragmatic, costal mediastinal, and phrenico-mediastinal. Phrenico is a diaphragm, we know that. Phrenico-mediastinal recess. Out of these 3 recesses, we can see here costal diaphragmatic recess, and it is the most important recess. First of all, it is the largest one, and also it is important because you know when people have pleuritis and they have liquid inside the pleura, doctors are taking out this liquid. So they are going from this portion exactly, from the costal diaphragmatic recess. They are doing this punction, okay, from that recess. So that is important and we have to remember. Now about pleura, we have to know the borders also of the pleura. For the visceral pleura, it's the same as it is for the lungs because it's following the lungs, right? For the parietal pleura, I will tell you what are the differences for the borders. So in the sternal line, it's the same, okay? Then we have medial clavicular line. For lungs, we had on medial clavicular line, we had 6th rib, right? It was okay, and the border was on the projection of the 6th rib. In this case of pleura, parietal pleura, the border is projected on the 7th rib. So it's 1 rib below, okay? Then on axial line, we had on the projection of the 8th rib for lungs. In this case for pleura, we have on the projection of the 10th rib. So 2 ribs are different in this case. And this difference is given by this costal diaphragmatic recess. That's why we have 2 ribs below, okay? Then we have scapular line, and we had on the lungs were projected on the 10th rib, right? In this case, for pleura, we have 11th rib. Again, 1 rib below, again the same way. And for vertebral line, we have also 1 rib below, which makes it 12th rib for pleura, because we know for the lungs it was 11th rib. So to sum up, we have 1 rib difference in each case, except of medial clavicular line, where we have, except of the axial line, where we have 2 ribs difference, because on the axial line, lungs are located on 8th rib, and pleura is located on the projection of the 10th rib, okay? Now, about mediastinum, a couple more words. As we said, mediastinum is a space between lungs, right? For mediastinum, we have to know the walls. So, let's look at this picture. So, the space between lungs. We have to know the walls. For anterior wall of mediastinum is located sternum. So, anterior wall is made of sternum. Posterior wall is made of vertebral column, okay? And lateral walls, if mediastinum is a space between lungs, then what is? Lungs itself, right? So laterally we have lungs, anteriorly we have sternum, posteriorly we have vertebral column. It is considered that trachea, we studied trachea, right? Trachea is dividing mediastinum into anterior and posterior parts. So the space is divided, it's just considered like that. The trachea is dividing mediastinum into anterior and posterior parts. And different organs are located in each part. So we have to know these organs because you will have that for sure in the test. The organs of anterior part, anterior mediastinum, are thymus gland, we will study this with endocrinology, thymus gland, aortic arch with its branches. Then we have superior vena cava, okay, heart with its pericardium, and also diaphragmatic nerves. Okay, let's repeat. Thymus gland, thymus gland, aortic arch with its branches, superior vena cava, and heart with pericardium and diaphragmatic nerves. For posterior mediastinum, oh, good timing. For posterior mediastinum, we have, no, it's not the picture for posterior mediastinum. Well, anyways, we have esophagus, okay? Write down if you were writing down that. We have esophagus, we have, the esophagus was surrounded with some kind of a nerve. Anybody remembers?
Vagus.
Nerve. Vagus. Remember I told you it's surrounded with the vagus. That's why it's difficult to make the surgeries. So esophagus and vagus. Then we have azygos and hemiazygos veins. Okay. Sympathetic trunk. Sympathetic trunk. And also I think thyroid artery. Wait a minute, there was something more. Thyroid. There was something more. I know I'm forgetting something, so let me tell you. Well, I will remember and I will tell you, okay? I forgot something. Because there was one more. Okay, I will tell you that when I remember, because we don't have that on the picture. So, this will be your next material. And please study.